Doctors, what is the weirdest thing a patient wouldn't admit? Story 1. Sometimes it's worse what they do actually admit. This one guy, obese, comes in because of a sharp superficial pain on movement in his upper right loin area. Has no idea what it could be. Takes 2 nurses and me to lift up his belly. Aside from some rash and fungus in the creases, there's also a large wooden splinter sticking in his skin. His wife, who was present, exclaims, "Right, this must be from the love board." Me. The what now? Her. Well, when hubby wants me to get down on him, I lay him on the bed and use the love board to hold up his belly. He must have gotten the splinter from there. I recommended ointments for the fungus, regular changes of the bandages of the wound, exercise, and a weight-reducing diet, as well as using smooth and treated boards in the future to prevent splintering. Have you ever tried to hold down laughter and vomiting at the same time? Story 2. I'm not a doctor, but work in the medical imaging field. I once went to a site in Texas and repaired their MRI machine. I asked the staff if they wanted to test the machine on a patient before I left to fly back home. They said yes. They had a coworker there who needed his knee examined, so the guy comes in the room and we ask him all the questions, including, "You don't have any medical implants, electronics, or metal items on your person, do you?" He assured us he did not. So we put him in position and wham! The MRI machine, a big magnet, yanks his concealed carry pistol out of his waistband into the magnet. Did $20,000 worth of damage to the machine. Sorry, but that MRI machine might be a big magnet, but it sure as hell can't take away his freedom. Also, who the hell is carrying a pistol in a hospital in their waistband? What kind of... No, I can't get this worked up this early in the video. Gotta control the flow and not let the dam burst. Story 3. Had a homeless patient come in for a colostomy bag replacement. He said it got dislodged while sleeping. No big deal. Life on the streets is rough and crap happens. He came in 3 days in a row for the same complaint. By day 3, everyone knew the guy was lying about it falling off. Come to find out, he finally told one of the doctors he was selling his colostomy site on the streets as a Detroit sidecar. Look it up on Urban Dictionary. I always wondered if he charged extra for dirty talk. Story 4. I had a patient in clinic who said he'd been feeling a little lightheaded lately and wanted to know what was going on. He said he drank maybe 1 beer per week. At one point in the visit, he passed out and vomited on me. When he came to, I asked if this had happened before. He said yes. I asked him if this is what he meant by lightheaded. He said yes. I got some labs. His sodium was super low. At this point, I asked him to tell the truth about his drinking, since this was clearly a case of beer potomania. He eventually admitted that he drank at least 6 beers per day and almost never ate food. Yeah, no crap. We did manage to keep him from dying, so that's a plus. Story 5. Not me and not a doctor, but my mom's a dentist and I used to help her with her files and stuff. One day this dude had an appointment booked on a Saturday morning and you could smell like 50 different kinds of alcohol on him. I swear, it was like a effing brewery. The effer was also clearly crap-faced and probably didn't even sleep that day because we found him by the front door while opening up the place at 7 a.m. and he was waiting there for God knows how long. He didn't want to admit he went out last night to drink. Instead, he insisted that his wife had told him to rinse his mouth with moonshine in order to sterilize his rotten tooth before my mom pulled it out. Before saving, and that's saying something when it comes to my mom, the woman absolutely hates pulling out teeth. When he opened his mouth, it was death. I was like 5 feet away at my desk filing and organizing the weed's patient files, and I could feel it. This mother effer probably hadn't brushed his teeth in the past week. He never admitted he was sloshed, which makes it worse seeing as this was a small town and he was the guy that held the title of Town Drunk. I'm pretty freaked out over the thought of anything going wrong with my teeth, so I brush twice a day, 2 minutes after flossing, of course, so I feel very bad for this guy, but also, folks, this is why you take care of your teeth. Please, take care of them. They don't have to be perfectly straight and perfectly white because that's just isn't human, but the opposite, like this guy, isn't better. Story 6. Med student. Went to see a patient for my practice physical. These are all volunteers, and we don't get charts or anything, just a slip of paper with their name and chief complaint. I walk into the room, and this older gentleman is holding his cup of coffee and didn't shake my hand, which threw me off guard. Then I noticed one of his hands was much weaker and kind of scrunched up, and he didn't move it. So I asked him about it, and he was like, "Nah, it's fine. See? and proceeds to move it like a half inch. It clearly was not fine. I'm sweating now because these are mainly just opportunities to talk with patients and there's supposed to be a breeze, but this guy looks like he had a stroke and had no idea. Turns out he was just messing with me, but I was ready to call in a real doctor because I was freaking the F out. Edit. This dude really did have a stroke. It was 15 years ago and only affected his one arm. He just liked to pretend it was fine. Once he made that clear, the rest of the history/physical was great. Story 7. Patients lie about the most mundane things. They will tell you they don't smoke cigarettes when you can smell it all over them. You can see a pack in their purse and you physically saw them smoking outside before they came in for their appointment. That's not what annoys me, though. What annoys me most is the patients will Google what they think is their diagnosis, admit they did, get their diagnosis right, then argue with you about the recommended treatment and deny having read that also. The classic example is bronchitis. Patients will Google it, read the Wikipedia article, then come in and demand antibiotics. When you confront them with this, they will pretend they didn't know that they read that antibiotics do not work. They will do this with almost any disease in which the treatment is conservative management, and yet they will still come in asking for treatment that has no evidence. If you're going to become an internet expert, don't do it 50% and deny you didn't read the part about treatment. Edit. Roughly 80% of what comes into urgent care can be managed at home with do nothing, rest, drink fluids, take Tylenol. I honestly just don't get lying to your doctor. Seriously, you're paying them to make you better, so why not just trust them? Also, are you all not super excited about having a person that you can just admit your BS to? I love finally getting to admit, yeah, sometimes I wrap deli turkey in slices of American cheese as a snack. Is that bad? Story 8. I am a doctor. Not a single random thing up my butt is weird to me anymore. I've heard or seen it all, nor is it that surprising when somebody is wacko enough to claim they got Lyme disease in intercourse from their husband, who got it vertically from his mother, and that's why they are sterile. If you aren't aware, this is bonkers. The actual weirdest thing for me was that one time when a severely obese person just refused to admit they ate anything but one small salad a day. It just comes down to math. You cannot get up to 500 pounds unless you put 500 pounds of stuff into you at a decent pace. Plus, we found a snack wrapper in the inaccessible folds in your panis. Jeebus. Story 9. One of my lecturers told us a story of when he worked in ED, there was a man who refused to acknowledge or tell them how a jar got stuck in his rectum. They were taking him to the OR as it has created a vacuum seal and couldn't be removed without shattering, but realized his BSL, blood sugar level, was off the charts, really, really high. They were considering postponing the surgery to work out what the F was going on. When he ended up talking, he told them the jar was full of honey before it got lodged and was rapidly absorbed by the rectum, causing the insane levels. What? Oh, bother. Story 10. Other than all the random things that end up in rectums accidentally, drunk electrician with the longest drill bit I've ever seen sticking through both legs and impaling his scrotum in between like a really gross kebab. He was so drunk he thought he broke his hip, denied owning any drill bits or, for that matter, having been drinking. Most common are the numerous drug/tox screens we do that come back positive for something, and everyone is shocked, borderline offended it got into their system. Medical professionals are like the one person you can't lie to about that crap. They can take your blood and be like, look at that, drug blood. Seriously, why do you need to save face with your doctors? You want them to think you're cool so they'll ask you out to the prom, you dorks? I know there are actual psychological reasons, just let me exaggerate and be silly. Story 11. Had a patient in hospital, I forget what for. The point is that he disappeared for a few hours. When he came back, he was tachycardic to 160 beats per minute. Massive pupils, couldn't sit still. We asked him what he'd taken while he was out. Nothing, he swears. He went to the pub and just drank lemonade. Okay, we say, we're gonna take some blood and find out what you've taken. He then pipes up that the friends he was with would think it was funny to spike his drink. What, we asked, did he think they might have spiked his drink with? Speed, he says. What do you know? Blood's confirmed that he has taken speed, but he insists he didn't take it. His drink was spiked. Story 12. I'm a CT tech and I was to scan a woman's abdomen for belly pain. She and her girlfriend were there. I have to have a pregnancy test. I have to have one done. I can't radiate a fetus. I even ask nuns, so no exceptions. She denies up and down she's pregnant, and then, after the test I did, it said she was. She denied it and demanded a blood test since she was a lesbian and never has intercourse with men. Well, the blood test came back positive also, surprise, and the argument that ensued was biblical. She was arguing with her girlfriend and the nurses and the doctor. I never ended up scanning her, and they chalked up her pain to her being pregnant. The look on her girlfriend's face when I said it came back positive was one I will never forget. Edit, because I've gotten this comment a lot, the woman in the room with the patient was her significant other, and they had been together a long time, and the patient had given her significant other permission in writing to allow her to hear her medical information. Many of you are saying you shouldn't have told her in front of her significant other, and you're partially right in a way, but the patient had given her significant other that permission, and I did not question it. Had she not, I would have asked her significant other to leave the room. You can give anyone you deem necessary access or no access to your medical information. It's not limited to spouses. Oofda. Okay, now that's a rough one. Can't think of a much worse way to find out about infidelity, and that sucks for them. I can't blame the tech, but also, if that is something I came across, I might have tried to at least privately go to the patient and whisper, "You are super preggers and need to tell your partner," but also, want me to pull the fire alarm? Please like and subscribe if you've made it this far. I hope you'll enjoy the rest of the video and have a wonderful day. Story 13. I'm a pediatric dentist, so maybe not the type of doctor you were looking for, but this one throws me for a loop every time, so I'll share it. When I sedate kids, they have to be NPO for 8 hours before, so I always ask if they had anything to eat or drink in the morning. Parents never want to admit their kid ate or drank, even when I remind them it's very important because if they vomit and aspirate, they could die. Often they try to minimize it and say it was just a few bites, but one kid walked in eating a bag of Cheerios at reception, and then the parent insisted to me that they hadn't eaten. Yeah, I'm 100% not sedating your child today. Story 14. That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions, instead of, say, to read the details on the sheet. Story 15. Once had a woman come in for a possible yeast infection. On exam, she had a glass bottle stuck in her vagina filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, "I think this is all a joke and you put it up there." Yeah, she was totally trying to cheat a drug test. Definitely, the bottle had an overly complicated apparatus which allowed her to discreetly trigger the urine to come out, which made it all the more weird she pretended we hadn't just pulled CIA tech out of her cooch. I think you put it up there is a hell of a thing to accuse a doctor of, but also what did she think was going to happen or was happening? She's like, "My hoo-hoo hurts. I wonder if it could have anything to do with the bottle of pee I shoved up there. No, that can't be it. It must be a yeast infection. I'll leave the bottle there and go have them check me out." Story 16. A very sad one. My mother was a paramedic and she was called to a drug overdose. A young male in his late teens was drifting in and out of consciousness. Before my mother could treat him, she needed to know what drug he had OD'd on so my mother could administer the relevant drug. He refused to say in case if the cops showed up and got him done. He was petrified of the consequences that actually didn't exist. You can't be arrested for having drugs in your system. He continued to deny he took any drugs to avoid this scenario from happening, but despite my mother insisting to him that he will be okay, he sadly died there and then. Story 14. I work in an ER taking medication histories for patients that are being admitted. The amount of patients that tell me not to add things to their history is ridiculous. They say that they don't take things like their Norco very often, and after asking a lot, I got them to admit they took it today. The best one, though, is asking husbands about their ED medication. I have to find out when they last took any of their medication, and if a spouse or significant other is in the room, the husband gives them a weird look. I hope I say the right dates so she doesn't think I'm using the ED medication with someone else. Good Lord, people, you would think if you were going to the doctor with secrets, you wouldn't bring along people who you're keeping those secrets from. This feels pretty obvious to me, but I also don't have weird crap to hide. Or maybe I do, and I'm just that good at hiding it. Do I? I don't know, I forget. Story 18. A guy came in with excruciating back pain, and MRI showed severe discitis. Well, we knew he had a history of IV drug abuse, so we couldn't send him home with a PICC line to get several weeks of IV antibiotics, easy access. So he was going to be with us for a while. Well, after about 2 weeks, he kept having a sketchy visitor. One night I was working, and a code blue was called. I run to his room to find him sitting at the edge of the bed talking. I'm incredibly confused because they definitely called a code blue to his room. I look over, and sketchy friend is lying on the bathroom floor with a needle, syringe, sponge, and lighter beside her. She's not breathing and completely gray. Even after 2 rounds of Narcan and transferring her to the ED, he would not admit she was doing drugs. I don't associate with those types of people. Right. Story 19. Not me, but an OBGYN relative of mine about 30 years ago. Young newlywed couple comes in, OBGYN emergency room for intense pain. Upon digital examination, a mass is felt. Elder surgeon arrives, examines, and pulls out a lemon. Family of the brides demands to know how could a lemon grow there. Daughter stays quiet and blushing. Older surgeon suggests lemon seeds must have migrated from the stomach. Everybody goes home happy. The groom was smirking the whole time. Why are people putting lemons in their body? I feel like sour citrus is a bad choice. Maybe it's a size thing or a citrus thing or both. Tangerine's too small, haven't worked up to oranges yet. Okay, I get it, I guess. Story 20. Don't know if this quite fits, but I had a lecturer who told us about a case he came across. He got called out to a nightclub after a fight broke out. He noticed a big 6-foot bloke stood at the bar acting really shifty and overly nervous. My lecturer went up to him and told him if he had any drugs on him to go flush them because the police were checking everyone. Guy insisted that he didn't have drugs. After talking for a while, the guy eventually opens up and says, I am hiding something. I have XYY syndrome. I'm only 12 and I don't want the police to tell my parents. Story 21. Happened to me, but I was in med school. Was on a GYN on ONC rotation, and a 50-something-year-old lady comes in with an enormous ovarian mass. It was so big she looked pregnant. She was hiding it from her family members, but it was putting so much pressure in her abdomen that she couldn't eat anymore and was losing weight despite this mass growing to epic size. When we finally removed it, it weighed just shy of 45 pounds. She had lost so much weight that it was almost a third of her mass. She actually ended up doing quite well. The only good thing about a tumor this big is that it's almost always benign. If it had been malignant, she would have died years earlier from it. Story 22. I was rotating through trauma surgery my intern year. I was called to the ER to evaluate a mid-30s male who fell off a roof while working. It's standard procedure for any level 1 trauma to cut off their clothes and do a full head-to-toe evaluation. The nurses were about to cut off his pants when he adamantly refused. We kept asking him why, telling him we see this stuff daily. Once we finally cut them off, we found an intact male chastity belt with a gold padlock. He stated that his girlfriend kept the key. I've also seen a male come in not once, but twice with a kid's bowling pin up his rectum. The first time he refused to tell how it happened, the second time stated his girlfriend enjoyed it. No sign of the other 8 pins. People who wear male chastity equipment often don't consider that it could be an issue in certain situations, like going through a metal detector in a sports arena. That would probably be a pretty weird conversation, too. Ooh, or an MRI. Now that is worse than a pistol. Story 23. My mom is a radiographer, and she deals with a lot of people who slipped and fell on objects that go up their butt. She really couldn't give a crap what you were doing to get the object stuck at this point, so there's no point trying to hide stuff. Anyway, a kid, probably about 15, came in with his mom because he had a Barbie doll up his butt. He had done the smart thing and pulled its arms off first, but they couldn't see a head on the scan, so my mom had to try to get him to admit to doing it on purpose so he would tell them whether there was a head on the doll before it went in. Apparently, he stuck to his gun, saying he didn't do it on purpose, so how would he know? In the end, they pulled it out and sent him home, only for him to come back a week later with severe stomach pains, and what do you know, there was a doll's head in his colon. Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.